Hello and welcome. We had quite a few people who dialed in early on our inbound participant line, but we wanted to start our dial out a bit early tonight and make sure we caught you all. Thank you so much for being on time and prompt. Please bear with me though, as we are dialing out to over 5,000 numbers tonight, and we want everyone to get on before we get started. As you, I am sure, aware, we have a lot of information that we are coming to you with tonight. So again, good evening and welcome. If you are just getting our call, you are live on the line for our SEIU Healthcare Minnesota telephone town hall meeting we have for you tonight. Tonight you're going to hear from our president, Jamie Gully, and then we are going to have two different Q&A portions. Our first Q&A portion, we want to discuss hero pay. Our second Q&A portion, we want to discuss vaccine mandates. Now, if you have a question, comment, or concern, if you'd like to join those Q&A portions, please press 0 on the keypad on your phone. Again, to get in line with your question, comment, or concern, please press 0. You can do that at any time throughout this forum tonight. We are going to be taking your questions live, but if you'd rather not go live, that's fine. Still press 0, still get your question in line. Just let your operator know you'd rather not go live. I'd be happy to take your question over the air. So again, good evening and welcome. Thank you everyone who's already on the line. We are going to start our call right at the top of the hour. We wanted to start our dial a little bit early tonight just so we can get everybody on and get started promptly at the top of the hour. Right now would be a great time for you to grab a pen and paper, as you are going to hear from our president, Jamie Gully, a lot of information. So get a pen and paper, a notepad if you want to jot down some notes. As I said earlier, we're going to have two different portions of Q&A during this forum. Our first topic of conversation and Q&A will be discussing hero pay. Our second topic of discussion and Q&A will be discussing the vaccine mandate. So if you'd like to get in line with your question, comment, or concern on either one of those topics, go ahead and do so now by pressing 0 on the keypad on your phone. You can also use that feature at any time throughout this forum. If you don't have a question yet, but you've come up with one as you're hearing discussions, feel free to press 0 then as well. I will tell you, though, we are anticipating a lot of questions, so you might have a better chance of getting yours in if you get in early with that question. Also today, we are collecting your most updated contact information. Again, lots of information coming. We want to keep you educated going forward. To provide us your most up-to-date contact information, please press 7 on the keypad on your phone. So again, that's a few things today. Press 0 to get in line with your question, comment, or concern. Again, we'll have two different Q&A portions. First one will be discussing hero pay. Second one will be discussing vaccine mandates. Pressing 0 on the keypad on your phone to provide us those questions, and then to provide us your most up-to-date contact information so we can keep you up to date going forward, please press 7 on the keypad on your phone. That might be your up-to-date email address, up-to-date cell phone number. We just want to make sure that we can keep you up to date, so press 7 with that. So I'll go through this introduction probably one and a half more times. We're going to get started promptly right at the top of the hour. We wanted to start our dial out a little bit early so that we could get our dial out finished and start right on time tonight. So bear with me as I do go through this introduction. Right now would be a great time to grab a pen and paper. You're going to hear from President Jamie Gully. A lot of information. You might want to jot that down. So again, grab pen and paper and then pressing 0 on the keypad on your phone to get in line with your question, comment, or concern. Again, tonight we're going to have two different discussions pretty much and two different Q&A portions. The first discussion and Q&A portion will be focused on hero pay. Second portion will be discussing vaccine mandates. So if you have a question, comment, or concern, please press 0 on the keypad on your phone. Also tonight we want to collect your email addresses and or your cell phone numbers, whatever is your best, newest, up-to-date contact information. That way we can keep in touch. So pressing 7 on the keypad on your phone to get in or to provide us your email address and or your cell phone number, just the best way we can keep you up to date going forward. All right, let's get ready to get started here in just a few moments right at the top of the hour. This is, if you're just joining our SEIU Healthcare Minnesota telephone town hall meeting, again, pressing 0 to get in line with your question, comment, concern, pressing 7 to provide us your most up-to-date contact information. And with that, I'm going to officially get our meeting started off by turning this over to President Gully. Please take it away.
Thank you, Allison, and good evening, sisters and brothers, and thank you for joining tonight's TeleTown Hall meeting for union members across SEIU Healthcare Minnesota. My name is Jamie Gully. I serve as the president of our union, and I will be leading our discussion this evening. Before we begin, I want to thank all of you for the work you have done as caregivers across the full spectrum of healthcare, in hospitals, clinics, nursing homes, and home care, in pharmacies, on ambulance crews. Every member has gone above and beyond through a trying year and a half. So thank you. We have 2 topics of discussion for this evening. First, we will be discussing the ongoing work by our union at the Minnesota legislature to achieve a hero pay bonus for all healthcare workers. And second, we will be discussing the policy proposals we have been receiving over the past 2 weeks from employers across our state related to mandatory vaccine programs. I want to start with the first topic, which affects all of us and which I believe we can tackle in just 5 to 10 minutes. I plan to begin the discussion on the topic of vaccine policies by no later than 6:15 p.m. to ensure that we have adequate time for member engagement, questions, and feedback. As the moderator mentioned, you can press 0 to ask a question on either topic, and I will stay on the line to take as many questions and opinions as we can before we adjourn. If your question is not answered on the call, you can also leave a message at the end of our call. Please leave your name, work site, and the best number for our staff to reach you following the call. We will work to ensure every question or discussion item receives a response by the end of the week. You can also email questions, concerns, or feedback directly to me at my email address. That's Jamie, Jamie.Gully, Gulley, at SEIUHCMN.org. As many of you know, we have been advocating across our union for more than a year for hazard pay, for bonuses for our members who have been working through the stress and complications of COVID-19. Our efforts came close at the federal last year, but stalled in the Senate. In Minnesota last year, we succeeded in passing $30 million for COVID expenses in nursing homes, and as a result, most of our nursing home members were able to successfully bargain hazard pay or hero pay of some sort, with increases of $2 an hour to as much as $8 an hour when working on a COVID unit. We also won approval for a little more than $20 million as an emergency rate increase for home care workers, which resulted in most home care workers receiving a temporary increase or bonus during COVID as well. There was money approved by Congress and the legislature for hospitals and clinics for COVID expenses, but overwhelmingly, and with very few exceptions, our hospital and clinic employers refused to use this money for hazard pay. Mayo Clinic, Rivers Edge Hospital, and Chippewa County were 3 exceptions that did do the right thing. The hospital industry approach during bargaining was the same. They rejected any and all hazard pay proposals from all unions, and one employer was direct enough to state that unless the legislature specifically earmarked the money for hazard pay, they would not give any new money approved by the legislature to workers either. As a result of our mixed success and failures on hazard pay, we dedicated ourselves this year to work on specific designated fund at the Minnesota legislature for hazard pay for healthcare workers. Our proposal is and was to provide at least $1,000 to every healthcare worker who worked through the COVID emergency. Our proposal was ultimately supported by the Minnesota Hospital Association. The long-term care associations had their own proposals, but were generally supportive of the efforts as well. I am pleased to report that the legislature did ultimately approve a $250 million fund for hazard pay for essential workers. There is right now, including today, a committee of 9 people appointed to determine how that money is going to be distributed. Their decisions and recommendations on the money must be made by Labor Day and submitted back to the legislature for final approval. As you might imagine, all sorts of lobbyists and associations are now trying to get a portion of this money, and we believe strongly and unapologetically that healthcare workers should be at the front of the line. For context, there are more than 1 million Minnesota workers who are designated essential. If the $250 million fund is divided equally, everyone would get $250. We believe that healthcare workers should be at the front of the line, and we are demanding a minimum of $1,000 for all healthcare workers who worked through COVID. Our experience was uniquely dangerous, and the hardships for members and our families, some of whom had to quarantine, sometimes in garages or basements, members who are unable to visit with children and family members. We think our experience needs to be appreciated and recognized by the state, and we think it is past time due for us to get our hero pay. I want to thank the member leaders and everyone who has testified at the Capitol over the past weeks, including today, and I want to take this moment to ask everyone on this call to take time today to add your voice to make sure that the final decisions on this money include healthcare workers at the most possible amount we can. Please take time now or immediately after our call to go to our website, SEIUhealthcaremn.org, and sign the petition for hazard pay bonuses. We need as many signatures as we can for our proposal to ensure that you get the most out of this fund. We have waited far too long, and we want to make sure our proposal gets across the finish line by Labor Day. I will pause for one or two questions on hazard pay, and then we'll get into our next topic, which is the vaccine policies. If you have any questions on the hazard pay proposal, please dial 0 now.
Excellent. Thank you so much, Jamie. We're going to start with Sarah's question first, Sarah Ezekiel, but want to remind everyone you can press 7 on the keypad on your phone as well to provide us your most up-to-date contact information. We had quite a few people press that, but we have quite a few people pulling those out, so just be patient for us. Let's get Sarah live right now. She's an EVS aide at St. Joseph's. Sarah, you're live. Please go ahead with your question.
I was just curious as to when or if this goes through, how much each person will receive, as I feel that is totally unfair that everybody's getting bonus unemployment and hiring bonuses to sign on and go to work when all of us people have been working through this whole thing from the beginning up till now, and I don't think it's fair that people that are sitting at home collecting all this extra money on unemployment, et cetera, are getting, or basically, in my point of view, are way better off than the people such as us have been there the whole time through all of this, and we deserve something also.
Thank you, Sarah. And I think you make a really great point. For individuals who had the misfortune of being unemployed, there was additional unemployment that was provided to those individuals in the amount of $600 a week, at one point $300 a week. And healthcare workers overwhelmingly, with the few exceptions that I mentioned earlier, have not received the same level of hazard pay or hero pay or recognition. And we are bound and determined to make that happen. The legislature, as I mentioned, there is a 9-person committee working on this, and we want to add your voice and your signature to this conversation to make sure that healthcare workers are at the front of the line, that you don't have to go through hoops to get this bonus, and that the money would be paid to you as quickly as possible after the final decisions are made on Labor Day. So we want healthcare workers at the front of the line in this conversation. We think you deserve it. We think it's well past time for you to get the bonus. Thank you, Sarah.
Excellent. Thanks, Jamie. Thanks, Sarah. So thanks so much for joining our conversation. Let's get to Ezekiel next. I'll remind everyone after we take just a couple of questions on this forum, in this topic, we do have a way at the end of this forum for you to leave us any questions that we just don't have a chance to get to over the air today. So let's get Ezekiel live right now. Ezekiel, please tell us where you work and what your position is. And then go ahead with your question.
Yeah, I work at Burger King. Fuck Donald Trump, I'm out.
All right, Ezekiel, not a forum for this. Let's go right away to Stacy. Stacy is in school and works in a nursing home. She asked that I read her question. Stacy's question was like this. She feels they should be offered this hero pay. Any comments, Jamie?
I just want to agree with Stacy. Nursing home workers definitely deserve hero pay, as do hospital workers and clinic workers. And again, the point of the update here tonight is to let you know this is an ongoing discussion. We do have $250 million set aside, and we are working very hard to make sure that healthcare workers are at the front of the line and that you get an appropriate hero pay bonus. We've been working on it all year, and we hope to get this accomplished by Labor Day. If you didn't hear earlier, please make sure you go to our website and sign the petition. We are delivering petition signatures every day to the committee and making sure that the voice of healthcare workers is heard repeatedly and over again. We deserve the hero pay, and we deserve it now.
Perfect. Thank you so much, Jamie. Thanks, Stacy. Don't forget to go to our website. Let's get Catherine on before we move on to our second portion of this forum. Catherine works at United Children's Hospital St. Paul. Catherine, you're live. Go ahead.
Hi. Basically, my question is how does this apply to healthcare workers that are contractors within a hospital and have an employer that most likely won't pass the pay down to the employees if they receive it? How are we ensuring that these people are going to actually get this money?
Catherine, that's a great question, and one that we are working on with the committee at the legislature. There are a number of contractors. We also have hundreds of SEIU members who work at contract for food service companies and others inside of hospitals across the state, and we do believe that you should get that. Our hope is that this payment is not made through employers at all and is done directly from the state to the workers, and that we would be able to work with DEED through the unemployment office and others for those who work in hospital facilities. We can track that through state systems, and we think that the payment should be made directly from the state to workers without a middleman. We do not want the hospitals or anybody else to try to divert that money. It should go to you directly, and it should be from the state as recognition for your hard work. So that's our proposal and how we hope to accomplish what you were asking. I really appreciate your question, Catherine.
Yes, thanks so much. Great question. All right, Jamie, why don't you give everybody the website one more time, and then we can move on to our next portion of the forum.
Great. It is SEIUhealthcaremn.org, and the petition, you can sign it right as you get to the landing page for the website. So hope that everybody does that either right now or immediately after the call. Again, we're delivering petition signatures every single day to the committee at the legislature, and we want to make sure that your voice is added. Thank you, Allison.
Absolutely. Right. Should we do the discussion first, Jamie, or the poll question?
Let's start in the discussion on vaccines. So as promised, I wanted to make sure that we got into the discussion on vaccine policies here by 6:15. And let's just dive right in here. As you all know, in the past 2 weeks, employers have been advancing policies related to mandatory vaccinations. In fact, over the past 2 weeks, all of the major healthcare employers, including Sanford Health, Mayo Clinic, Essentia, Allina Health, Fairview, Health Partners, Children's Hospitals, a number of nursing homes, have all announced some versions of a policy for mandatory vaccination programs. Some employers have coupled their policy announcements with new mandates for flu vaccines as well. This includes Allina and Health Partners, although other employers may follow their lead. The policies are sometimes portrayed in the press as all being similar mandates, but the details really matter, and they are really not all the same. For example, the policy proposal announced by Mayo Clinic is a mandatory vaccine program, but not a mandatory vaccine shot. Individuals under that program would be required to get the vaccine, or if they wish to decline, to receive education about the vaccines. The education program would be on paid time and mandatory. It is intended to help members understand the virus, how the vaccines work, and to get any and all questions answered by Mayo Clinic physicians and virologists and others who know the science behind each. But members who choose to decline the vaccine after this education would still be able to do so, and then would be required to mask and follow additional health and safety protocols. Other employers have proposed mandatory vaccination, not just mandatory programs. And almost every hospital has proposed, or every employer has proposed, that new hires must have the vaccine before they would be eligible for employment. In the last 2 weeks, employers outside of healthcare, as diverse as Walmart, Disney, public and private universities, have all announced mandates of different sorts. In California, the Public Health Department has ordered a mandate on all healthcare workers. In New York, all healthcare workers have been ordered to get a vaccine or to mask and submit to weekly testing for COVID-19. The mandates are being driven by the increase in cases that we all see, that have resulted primarily from the Delta variant and the increase in viral load and contagiousness of the virus. In addition, there has been a public outcry by some who want COVID to be over and who are impatient with those who are hesitant or resistant to get the vaccine. 6 months ago, I was appointed by our national union leadership to serve on a special committee to make recommendations on vaccine policies on behalf of healthcare workers in our union nationwide. And I've spent hours studying this topic, trying to learn from members what our position as a union should be. Despite the time I spent on this topic, I have to confess that I was surprised to see us confront this issue of employer mandates before the FDA granted full approval of the vaccine. Now, we do expect the FDA to grant approval of the vaccines within the next month or so, and probably prior to any of the deadlines in these employer policies. But I believe that genuine concern over the Delta variant has sped up the process for this question. As a union, I'm just going to put it out there, I think this is a hard subject that we owe it to each other to wrestle through. How much do I as an individual owe my coworkers in creating a safe work environment? How much do we as a group owe to individuals who have concerns? I don't know that there is a 100% right answer or that we will all agree to one, but we have to use our best judgment and listen to each other with sincere solidarity as we work to create the best and safest health and safety environment for ourselves, our patients, and long-term care residents. Before we get into polls and questions, one thing to note about the policies, we have all had vaccine mandates in the past. In order to work in healthcare, we have had to confirm vaccines and deal with mantos for TB, etc. The decision on such requirements are usually made by the Department of Health, and they're final, and we all have to comply. Policy proposals from our employers, however, are mandatory subjects of bargaining. That means every employer is obligated to negotiate over their programs, how strict or loose the exemptions will be, what protocols will be in place for those who receive an exemption or who are permitted to decline the vaccine. For bona fide healthcare exemptions, we're looking to the ADA, the Americans with Disabilities Act, for guidance. And for religious exemptions, we're looking to Title VII. So for every judge who has been asked so far, every judge who's been asked to review the mandatory COVID policies that have been announced, without exception, has upheld the policy. Our best approach to dealing with the policies are to work with each bargaining unit to decide on proposals that reflect the concerns of the membership and bargain for the most fair agreement possible. Under our contracts, any final agreement that is considered reasonable to an arbitrator or judge will be allowed to take an effect, even if the union membership does not agree to the final policy proposal. So I want to be clear up front that, like many of our members, I got the COVID vaccine as soon as it was possible for me to get it, and I'm glad that I did. Our union believes the vaccine to be safe and secure, and we have conducted dozens of vaccine education seminars in English, Spanish, Hmong, Somali, and we're going to continue to do the education for all of our members about the vaccines, how they work, why we're recommending that members get the vaccine. But that being said, I want to hear from all of you as we're looking at these policies. What are you thinking about with these proposals? What do you think is fair? What do we owe to each other morally and ethically as we tackle this tough subject? We're going to do a poll. I'm going to ask Allison to do the poll, and then we're going to open up for member questions, forum. Feel free to weigh in with your thoughts and feedback. This is an opportunity for us to talk to each other about what we're working with here. So I'll turn it over to Allison for our poll.
Thank you so much, Jamie. A lot of information there. So as Jamie said, we want to hear from you now. You'll simply vote on the keypad on your phone by letting us know which one of these three options these concerns is most important to you. So again, we want to know which of these three options is most important to you in this moment in light of the ongoing pandemic, Delta variants, and employer proposals for a vaccine mandate. Again, there are three, and I'll go through this twice. Press 1 if you are most concerned about health and safety at work and think vaccine mandates should be on the table. Press 2 if you are most concerned about getting a COVID vaccine and need or want more information about the vaccines. Press 3 if you are most concerned about a COVID vaccine mandate and the ways the mandate could affect your job. So again, we want to know which of these three concerns is most important to you in this moment in light of the ongoing pandemic, the Delta variants, and the employer proposals for a vaccine mandate. Press 1 if you are most concerned about health and safety at work and think vaccine mandates should be on the table. Press 2 if you are most concerned about getting a COVID vaccine and need or want more information about the vaccines. Press 3 if you are most concerned about a COVID vaccine mandate and the ways the mandate could affect your job. So I'll leave that open so everyone can weigh in. And I'll remind everyone, as we open our discussion for this part of the forum, you can press 0 on the keypad on your phone to get in line with your question, comment, or concern. We are taking them live, but if you'd rather not go live, that's fine. Just let your operator know you'd rather me read it. I'd be happy to do that. Also, our queue is just about clear. If you want to make sure we have the most up-to-date contact information for you, you can press 7 on the keypad on your phone. That way we make sure that we're keeping you up to date going forward on important issues like we're discussing tonight. Again, pressing 7. All right, let's start our Q&A portion off with Becky. Becky is at River Wade Clinic. She's registration WFH. Becky, you're live. Please go ahead.
Hi, I just have a question or a concern regarding the shot. I have received my COVID shot, and I work at home with 15 other ladies, and several of us have received our shots, and there are several of us who have not received their shots and don't wish to receive the shot. My question is, because we don't work in the clinic, because we're not in the clinic, why would our department have to be mandated to get this shot? We have no contact with patients. And I am a union leader, and I understand. I represent all of the Riverway Clinic employees. And I feel for anybody that has to be put in a position to be mandated to get a COVID-19 shot when they do not want to. I don't agree with the mandate at all. You should not be forced to do something that you don't want to do. But in this specific case, I'm representing center registration, and there are several who, we've got a lot of people who have been in that department for several years. There is 30 plus years in that department for some people, and there's some that are going to walk away from their job.
Perfect. Let's hear what Jamie has to say. I want to get to as many questions as we possibly can. Jamie, what are your thoughts on what Becky was saying?
Yeah, and first I just want to appreciate your perspective, Becky, and appreciate you for calling in. On your specific question about the work from home piece of this, it is true that we have the ability to bargain the impact of these policies for each bargaining unit. And I think that you're raising a good and unique question about individuals who work from home and why should a policy apply to them if they don't have any ability to impact coworkers or patients. I don't know if there are circumstances where you do have to come into a clinic location or to a central location for training or for work that might lead the employer to think that would still be an appropriate requirement, but it is certainly something that we will absolutely address with respect to the Riverway clinics, and we'll be in touch with you and your coworkers when we're dealing with that. We are in the process of trying to gather information, and we're doing specific surveys across work sites as these policies come in, these proposed policies come in, and we're trying to address them as appropriate. So to the unique circumstance of those working from home, I think it's a very fair question and one that we want to address with your employer. So thank you for raising it.
Absolutely. Great conversation starter. Thanks so much, Becky, for joining our conversation tonight. We've got great questions coming in. Dawn, Elisa, Nikki, Jane, let's keep plugging along here. Dawn and Mercy, she's a nursing assistant. You're live. Please go ahead with your question.
Yes. Well, since it's against the law to mandate experimental vaccines on people, and the CDC isn't even requiring their employees to get the vaccine, why are we being forced? I have a vaccine. I have an immune-compromised child, but I don't want to, when's this going to stop? Because, why are we forced to have the flu vaccine? What is SEIU doing to protect us from having our rights violated? Because it is against the law. 37 people are about to walk off of my one unit. And that's a serious thing. And it should be a serious thing for you because you get union dues from us.
Thank you, Don, for your question. And I just want to say that first and foremost, I do not believe or believe it is accurate to say that employer requirements on the vaccine are against the law. Where we have seen this go to court, every judge so far has ruled that employers are within their rights to mandate the vaccine, both the flu vaccine or the COVID vaccine, as a condition of employment. You do have union rights, and you do have the right to bargain over these policies. I'm going to just take a moment here to respond specifically on flu, because Alina is proposing flu as well, and say that we have adamantly opposed the flu vaccine as a mandate for a condition of employment because it is not as effective as other vaccines. We don't think it's appropriate to be a condition of employment with the effectiveness of the flu vaccine. I kick off the flu season every year. I'm one of the first people to get the flu vaccine. I get it at Health Partners with the CEO of Health Partners, and encourage everyone to get it. And our union encourages folks to get it. But as a condition of employment for flu, we just don't think it's appropriate. And that has historically been the case, and that's not even under discussion for the union nationally with respect to the vaccine committee on which I serve. With COVID-19, the effective rate of the COVID vaccine is much higher than flu. It's in the 90% range. It is true that it doesn't have full FDA approval at this point, but we do think that the FDA approval will be in effect before any of the deadlines from any of the employer policies. So I don't want to rely on full FDA approval of the COVID-19 as sort of an option for us to argue or an argument against the policies, because I think that argument won't be there by the time the policies go into effect. I think you have a good point on flu. I just want to say that, we do intend to represent individuals and also to try to balance the rights of individuals with the rights of the group who really want to see a health and safety workplace. And that's up to all of us to figure out together. So that's the purpose of this call and what we're going to be working on over the coming weeks and months. I really appreciate your feedback, Dawn.
Thank you so much. Thanks, Jamie. So glad to have you join our conversation, Dawn. We get to Alyssa now. Elisa. She asked that I read her question. She works for To Care for You Home Care. She's a PCA HHA. All right. Elisa says, will we eventually be mandated to get the vaccine, and is there any way to stop the state from limiting our hours? It would help her immensely to give care to her clients.
That's a great question, Elisa. So the short answer is we do not have any notion from the state or for folks in the home care contract for our union that there is a mandate being proposed or being offered. There is not one at this point. So you're not in a category where that would be offered as a condition of employment. And I don't know that we will see one for home care workers. If we do, we will certainly conduct full information gathering, and we would have the right to bargain over the impact of that. But we would have to take and see what the proposal looks like if it came. As to your hours, that is an ongoing thing that we are working on. It is pretty constant. You do have a new contract that went into effect on July 1, but the hours question continues to be an area of discussion. But no solutions there yet. So we are going to continue to work on that, and we'll make sure that the home care organizers are able to reach out to you on your specific issues, but we're going to keep working on the hours cap for sure. Appreciate your call, Elisa.
Thanks so much, Jamie. Thanks, Elisa. We have Nikki up next before Jane, and then Brenda. Nikki works for Health Partners Hospice. She's a medical social worker. Nikki, you're live. Go ahead with your question.
Hi, Jamie. My question is, please help me understand how all I hear is mandate the vaccine, but there's no discussion about natural immunity, which has been proven by the Cleveland Clinic plus other reputable clinics. And there's also no discussion about the effective treatments for COVID that have been censored and suppressed by the mainstream media. So to me, it seems like if you go against the agenda, there's no information out there for people to make an informed decision.
Thanks for the call, Nikki. I do think that members deserve to have questions answered about the vaccine. I do really appreciate the approach that Mayo Clinic has taken in their proposal that is going to ensure that members get paid time to attend education about the vaccine before they make the final decision on whether they're going to get the vaccine or decline. And I think that everybody deserves to have those questions answered. I also think that you deserve to have that conversation with your physician as well. I'm not familiar with any of the studies that you're referencing. I can say that I got the vaccine. I considered it safe. I've read as many studies as possible as I could on this. It is considered safe. There are many individuals who have medical conditions who want to be sure that the vaccine won't interfere with those medical conditions. And for all of the individuals in those circumstances, I truly and sincerely believe that you and your physician should be in conversation. And if there's medical exemptions, regardless of the policies that go into effect, medical exemptions will be provided. And if you need help with a medical exemption as we work through these policies, we want to be there to help members with medical exemptions. We want to make sure that you're in conversation with your doctor about it, especially if there's going to be a mandatory vaccine policy that comes from an employer. But the short answer is, is not the person who is your doctor. I can't advise you on whether or not you could seek a medical exemption, but I just want to encourage you to do that. And we are going to work with employers to make sure that everybody gets your questions answered. But at the end of the day, do they have a right to do it? They're arguing yes. Most of the judges have agreed. And at the end of the day, it will be what we bargain with the employers and what that outcome is. So more to come on that. We're just starting the process of the engagement with employers to see how strict or how strict or not strict they're going to be with the exemptions. And then just for those who philosophically decline, we'll have to see where we can get with the philosophical declinations. But medical exemptions, please do connect with your physician to get your questions answered on that. And I appreciate your call.
Great. Thanks so much, Jamie. Thanks, Nikki, for joining our conversation. We have a quick comment in here that came in from Rachel. On your thoughts on it, Jamie. She's a CSA at Children's Hospital. She asked me to read her comment. She says she understands that people have hesitations, but they need to understand that working in healthcare is a privilege and not a right. We have been mandated to get vaccines in the past, and this should be no different. Any thoughts, Jamie?
It is true that we've had mandates in the past. Employer-based mandates are a little bit different, and so I kind of understand some of the reactions that members are having. If the Department of Health issued this mandate, there's no questions asked. That just would be what it is. We wouldn't even be bargaining over the mandate. The Department of Health would just make that decision. But it is an employer-based mandate, and to your point that you feel good about it, you think that other people should get it. I have a lot of sympathy for that too. I've gotten the vaccine. I'm encouraging everybody to get it. I think everybody should get it, or if they have concerns, to talk with their physicians about it. But I also want to respect that we don't all necessarily agree on that topic here tonight. So that's why we're having this discussion. What do we owe each other to be safe? What do we owe to our patients? What do we owe to each other for your individual rights and concerns? So it's not an easy answer, I don't think, and it's going to require a lot of discussion and solidarity for us with each other. So I really appreciate your perspective, Rachel, and I'm glad you added your voice to the conversation.
Great, thanks so much, Jamie. Let's get to Jane now. Oh, we'll get to Jane in a yes, actually, let's get Jane live. Jane, at the Fairview Riverside campus. Jane, you're live. Please go ahead.
Hi, my question was the same as everybody else as far as the mandate and stuff, and like he just stated that I might have to get medical, talk to my doctor because I have concerns about if I do get it and something happens, will Fairview take care of me? See, they're not talking about that either. They want you to sign something when you do get that shot, so and then it's in fine print. But if something happened to me while I'm getting this shot, even though I don't want it, are they going to take care of me?
All right, Jane, thank you for your question. And this is something that we will be addressing in bargaining. So most of the employers we have worked with since the vaccines became available in December, we all know that some people have had some reactions to shot 1 or shot 2, depending on which one they've gotten from Pfizer or Moderna. And we have been successful in getting employers to pay for, a day or two for the recovery time. I don't think that everybody's needed that. It's certainly not everybody, but, some people have, and that has overwhelmingly been made available. If there's a longer term reaction to it, you raised a good question on whether or not you would be eligible for workers' compensation or other benefits from the employer. And that's something that we will absolutely address through collective bargaining, so you can have an answer to that. But my guess is that you would, but I think you deserve a full and final answer to that, and I'm going to write that down as one of the topics that we want to get resolved, not just for Fairview, but for all of our members. But yes, if there's a longer-term complication, workers' comp eligibility, et cetera, in light of the mandate, certainly not an unreasonable request if you ask me.
Great. Thanks so much, Jamie. Thanks, Jane, for joining our conversation. Next up, we're going to go to a caller who wished to remain anonymous, and that I read her question. She says, if we're mandated to get the vaccine, who's going to be held responsible if I have a medical issue due to getting it? So kind of similar to Jane's question there.
Yeah, I think it is a relevant question, and this being a condition of employment question, I think you raise a good question. I can just say this: I will commit to getting that answer for everyone as we can to ensure that is resolved for folks. But I do believe workers' compensation or other programs would be available in that sense because of the mandate. But let's get that question answered for you fully and finally before you make a decision. It's a fair question.
Great. Thank you, Jamie. All right, let's go to Crystal now in Alina, the Health Unit Coordinator. Crystal, you're live. Please go ahead with your question. Crystal, are you there? You might have us on mute.
I am. I was just really, in all honesty, just wondering, I am allergic to the flu shot. I am nervous about getting the COVID shot. I am a HUC right now. I was a CNA. I don't have real patient contact. And there is resources out there that says things like, you can fill out a paperwork and then your employer will be held responsible for them to take care of you. I guess my real honest question is that, this is kind of, I feel like it's violating my own HIPAA, my rights to my person. And where are the papers that we fill out to be able to get cleared from this? They said that they were going to give us some, and, the time is already coming. If my doctor is willing to sign off on my flu shot, they should be giving us a suffice amount of time to actually be proactive for ourselves. I guess I'm more nervous that if you guys, the union, aren't able to go with this and help us with this, we should be able to fight it ourselves. And Alina's not giving us a suffice amount of time to fill out this paperwork and whatnot.
So thanks for your question, Crystal. And I just want to appreciate that it sounds like you have a specific medical concern that you already discussed with your doctor. And yes, I would say that you deserve to have the ability and process to make sure that you have all of your rights in pursuing a medical exemption upheld. And you'll definitely have support from us on doing that, and make sure that, you're able to get that done. As far as the timelines that they have outlined, we have also requested a significant amount of information from Elena and from other employers to share with us the documents, the process for these medical exemptions. We want to make sure that we're able to help anybody to make sure that you have time to get to a doctor if you're in need of a medical exemption or want to pursue that. So, yes, I just want to validate your concern around this and let you know that we do want to make sure that you have the time and the ability to seek that, especially for those with bona fide health concerns. It's just very valid, and you'll have support for us on that. Yes.
Great. Thanks so much, Jamie. Thanks, Crystal, for bringing that up. We've got Marie up live next. She is an in-home PCA. Marie, you're live. Go ahead.
Okay, great. Thank you. I'm asking if I do not want to be vaccinated, is it okay that I, take get tested once a week or every 2 weeks as opposed to getting vaccinated?
Marie, that's a great question, and one that we do intend to propose. You can see, as I mentioned earlier, different employers are proposing different things on this. Some allowing for individuals to decline with expectations around PPE, some with expectations around testing or frequency of testing. That will all be addressed in the context of collective bargaining with the employers, and even for employers that don't want to honor anything but a medical exemption or a religious exemption, I have to assume that they're going to need to bargain over this question, which is, what are the expectations for those who get the exemption? And we will work on those details with each employer and try to get the most fair option. For those who are working in home care or who aren't affected by a policy at this time, you don't have to do anything at this moment or this time, but I would encourage you to talk with your doctor about the vaccine and see if it's right for you. And if you haven't had a chance to get any questions you haven't answered, please do. But if you have an employer that is proposing a policy where medical exemptions are provided, we definitely want to make sure that you talk to your physician, talk it through, talk with them about the vaccine, make sure that you get your questions answered. We also want to provide and bargain for paid time from the employer to make sure that all questions get answered and that you get the ability to go through those processes. So for those with medical exemptions, we hear loud and clear for those who are concerned about this question. So you deserve to have answers. I appreciate your question, Marie.
Yes, thanks, Marie. Thanks, Jamie. Let's get Marissa live now. She's a nursing assistant at Methodist. There we go. Melissa, you're live. Please go ahead.
Yes. My concern is of a religious nature. So both the Johnson & Johnson and the AstraZeneca, I believe, vaccines are both used with embryonic cells from abortion and are contaminated cell lines. And then the other ones are mRNA vaccines, which would also be against my religion. I've been there a long time, and it's not something I'm willing to negotiate on, as far as I do want to be respectful of patients and my other coworkers, but I sort of feel at this point like if the people that are concerned have had the option to get vaccinated, if they're confident in the vaccine, then I really feel like I'm mostly a threat to myself in that respect. As long, I'd be fine with doing the PPE or the testing, but I guess, I don't know, I would be willing to leave over this, so I feel strongly enough about it. So I guess I just want to know what my avenues I can take are.
Thank you for your question, Melissa. Yeah, and I'm going to take it in two parts, if that's okay. The first being on religious exemptions, and religious exemptions are going to need to be pursuant to what we call Title VII under Civil Rights Act. It's going to have to, you'll need to probably produce documents and have your faith organization. We don't know what the process yet will be. I think you said you were at Methodist Hospital, and I don't know if that's at Mayo or at Park Nicollet, but to the degree that you have a policy, a mandate policy that goes into effect, and you want to pursue a religious exemption, there will be a need to document that it is a bona fide religious exemption. There is a process for that is well established under the law. It won't work to pursue a religious exemption under Title VII if the faith organization doesn't have sort of written tenets or some type of profession around the grounds for the religious exemption. I do believe that there are some for whom this will be available, but many religions don't have positions on it, or some people have specific faith beliefs that are not in doctrine with their religion. So if you need assistance with that, we would want to help you with that, but you'll have to definitely go through a process and work with your faith organization to document your religious beliefs and to show that in order to pursue the religious exemption. So we can help with that. On the question about being a danger to just yourself, I do respectfully disagree, and I'm going to just share why. We know that in some of the nursing homes where we have members where every one of the nursing home residents was vaccinated, that we are seeing breakthrough cases where workers, some of whom are members of our union, got COVID because they were unvaccinated, and it was transmitted somehow, some way to those who had been vaccinated, and it has had a detriment to the health of those residents. And so it is rare. The vaccines are not 100% effective. They're in the 90 to 95% effective range, but we're not able to absolve ourselves of responsibility. Even if we're vaccinated, we're still going to need to do a lot of safety protocols to make sure that we are protecting each other and our residents, including people who are already vaccinated. So I just want to share that, I'm aware of those cases. They're tragic, and they're real, and I just don't want to minimize that. Even those of us who are vaccinated do carry some risk when we're interacting with other people as a result of this Delta variant. So I do respectfully disagree on that point. But I really appreciate your comment and you're joining the conversation.
Thank you so much, Jamie. Thanks so much. Thanks so much, Melissa. Yes, great conversation we're having tonight. We've got time for, I think, 3 more questions, but I will remind everyone, if we do not get to your question, just stay on till the very end of the forum and you'll be able to leave us a voicemail message. Let's get Alyssa live right now. She's a medical assistant at Health Partners Clinic in Stillwater. Alyssa, you're live right now. Please go ahead with your question.
Hi. So somebody had mentioned like the natural immunity, like if you've had COVID and you have antibodies. My question is that something that we could bargain for, where if you can show, an antibody study or a result that shows that you have antibodies to COVID, same as the vaccine would give you, would that be a way similar to when we get hired and either have to get titers to show that we're immune or get the immunizations, if that would be a possibility in the future for something we could bargain for. The other thing I wanted to say is that maybe there have been mandates, quote unquote, but it's never been to this scale where you didn't even have the option to decline and you lose your job. Like, I work in occupational medicine and we do these exams, pre-employment exams all the time for Westfield, for Health Partners Clinic in Stillwater, and for Lakeview Hospital. And if you're not immune to like MMR, Hep B, varicella, you always have the choice to decline and you can still continue your employment. So we're not being given that option. This is entirely different than what we've been dealing with before. And it's honestly terrifying. I love my job. I want to keep my job, but I don't want to have my hand forced in something that I don't feel ready to make an educated decision on, even with the amount of education we've already been given. So my question is, what can we bargain for besides the religious exemption and the medical exemption, which a lot of us are not going to qualify for? I also want to say that this is not about supporting the vaccine and not supporting the vaccine. You can support the vaccine fully, but still not be in support of a mandate. And I think a lot of people that have already been vaccinated are in agreement with that.
Thanks so much for your question. And it is absolutely true that even individuals who support the vaccine have been vaccinated don't necessarily support an employer-based mandate. It is a good point for the conversation. And to your point on whether or not we can try to bargain for exemptions for folks with antibodies, I mean, the short answer is we can propose that. We can also propose for policies to be more like the Mayo Clinic policy, which provides for paid education time and the ability to decline with very specific protocols around health and safety, PPE, et cetera. And I think that, we'll be working with each group to decide the right approach to take. So the short answer is it is possible. I have heard from a number of individuals who tested positive for COVID-19 in the past year, including some who are long haulers that have concerns about, the vaccine and would it make it worse or could it reignite? These are all questions that I believe deserve answers to them. I think that there are a lot of studies related to this, and there's a lot of very encouraging science around it. But I think that everybody deserves to have your questions answered on this. And, pro-education, absolutely from the union, and also time for you to work this out, both with, virologist physicians from your work, but also with your personal physician. So, on that question, more to come. We'll definitely be engaging on that with health partners and others, like what's appropriate for folks to get and what's appropriate for what essentially would be an exemption based on a health status if you had antibodies, I guess, is what you're proposing. And the short answer is I don't know where we'll end up on that question, but we'll certainly work with you on that and explore it and see where we can get with that question. Appreciate the comment.
Excellent. Thanks so much, Jamie. Thanks, Alyssa. All right, let's get Carrie up live next. She asked that I read her question. She's a dental assistant with Pulse Partners, and she says she thinks there should be more leniency on exemptions to the vaccine. Your thoughts, Jamie?
I appreciate the question, and honestly, I'm really interested on this from all of you. Some members definitely side with that. Other members are saying they think that it should be mandatory, and they want to work as safe as possible, and they think that their coworkers should be vaccinated. I don't think we're all going to end up agreeing on this question on how much leniency, how much is mandatory. I think that trying to find that balance and trying to find the right answer, different groups might take different approaches to this, but I think it is a bit of a difficult question for us, this balance between the rights of the group to having a safe workplace and the rights of the individual. And, I think the medical and religious exemptions are a little bit easy, like we all understand that. And I think once you get beyond that question, I think it's more difficult. So I appreciate that you're weighing in here, Carrie, with your belief that there should be a little bit more leniency on the exemptions, and we'll take that into consideration. Absolutely.
Excellent. Thanks so much, Jamie. Thanks, Carrie. And I think this will be the last question coming up here and our allotted time for Q&A today. But again, you can leave us a voicemail message at the end. So let's get to LaDonna. She's at Abbott Northwest. She's a PhD. LaDonna, you're live right now. Please go ahead with your question.
Hi. I work at Abbott. It's not really a question. It's just that I've had the vaccine. My mom has a compromised immune system, and she lives with me. I would hate to go to Abbott, come home, and bring my mother to COVID, and she die. I think that would be way worse than getting that shot. You could go to the store and buy some aspirin and die. So I just think people need to rethink it, take their time, rethink it, do some research, and think about protecting their other coworkers too.
Thank you, LaDonna, for weighing in on that. And I will say I've heard from members who do have family members with immunocompromised systems, and they're very concerned about this question. I've heard from members who have family members who are in facilities, long-term care and otherwise, that have here recently gone back into lockdown because of outbreaks among staff at the facilities, and they're not able to see their loved ones right now. And they're very concerned about this question and are advocating for, much more stringency, I guess, on this question. I appreciate just everybody's perspectives on this and what we owe each other in this moment. And we have all, for the last 18 months, we have been going to work and doing our absolute best to protect our patients, each other, and our community. And unfortunately, we are seeing another increase with this Delta variant. And it is very scary, and people are reacting to it in different ways. And this is a tough conversation that we're going to continue to have across our union. This is our first conversation about it union-wide. But I just want to appreciate, LaDonna, your perspective and appreciate all of the conversation that we've had so far with folks who are sharing their thoughts and feelings about it. And so, we're going to continue on this question. We're doing surveys with each group where these policies are proposed. Not every employer has made a proposal for a mandatory policy, and definitely the details are different. And how those details play out in your workplace look very differently. But we do, as a union, have a say in what these policies are, whether we want them to err on the side of more conservative or more liberal on the policies for how strict we want to be. And we're going to do our best to help each other through this moment and to keep each other safe. And I do want to say that I think that regardless of where we end up on these policies and perspectives, I think with this Delta variant, we are in for another rocky road and a rocky fall as healthcare workers. And I want to do everything we can to help keep each other safe, to make sure you have the right PPE, regardless of how all of these questions get resolved. And I just appreciate all of the hard work that has gone into this last year and a half. I don't know, Allison, if we have any more folks in the queue or online, but I want to make sure that everybody who has a question gets your question answered. So if you didn't get it answered, please, be sure to leave your message here at the end or shoot me an email at my personal work email address. We want to make sure you get a response. And it is in flux. These policy proposals are proposals at this point, and we're going to be engaging with the employers to get to an agreement that is to the best that we can get for the members at each location, and we'll try to reflect, where folks are at in this process. But I just appreciate everybody in this conversation and how respectful we were, even at points where we had disagreements. Allison, I'll turn it back to you. I think we would want to get the results from the survey and before we let folks go.
Excellent. Thank you so much. Yes, Jamie, what a great conversation. So happy to have so many different voices on, and you're absolutely right. So let's get the results of that poll question. So again, we just asked you all, what concern is most important to you in this moment? We had most of our folks, 58%, said they are most concerned about a COVID vaccine mandate and the ways this mandate could affect your job. Beneath that, we had 36% who said you're most concerned about health and safety at work and think the vaccine mandate should be on the table. And then that final 6% that is most concerned about getting a COVID vaccine and need or want more information about the vaccines. So I know this is a continuing conversation and just want to reiterate what Jamie said. To get your question answered, please stay on the forum till the end of this call. I'm going to wrap it here in just a moment. Leave us a voicemail message. We do have quite a few questions we just did not have a time for in the allotted time we had tonight. So leave us a voicemail message, but remember to leave us your name, your phone number, and where you work so that we can have a fighting chance to have our union staff follow up with you. So again, leave us your name, your phone number, where you work, 3 important things, and then go ahead with your question. Just do that simply by following the prompts. Thank you again, everyone, for being on this hour-long forum with us, for joining this and making this a great conversation. As we did say, it is continuing, so stay in there and we'll keep you up to date. Thanks, everyone. Have a great rest of your evening.